A perfectly ripe banana contains enough concentrated natural sugar to trigger a sharp, immediate spike in blood glucose. For many, a diabetes diagnosis brings an immediate fear that every naturally sweet food is now permanently off limits. High-sugar fruits like bananas and dates are at the center of this confusion, often labeled as dangerous in diabetic circles despite their nutritional profile. The reality is that total elimination is rarely necessary. Strategic management allows you to include these fruits by controlling how your body processes the sugar. Shifting from passive snacking to calculated planning makes it possible to include specific fruits while maintaining tighter control over your daily numbers. The diabetes care team at Arka Anugraha Hospital in Bangalore uses specific clinical guidelines to help patients navigate these choices. Their medical protocol doesn't focus on whether you can eat fruit, but specifically on the timing and methods of consumption. The primary metric here is the glycemic index, or GI, which measures the speed at which a specific food raises your blood sugar. Because metabolic sensitivity varies, one-size-fits-all dietary advice can be ineffective or even risky, depending on your current level of control. Managing diabetes effectively requires moving past broad universal rules in favor of highly personalized, data-driven nutritional tactics. Let's look at the banana as the primary case study for managing high-sugar fruit within this protocol. As a banana ripens, its starches convert into sugar. To minimize the glucose spike, you should choose bananas that are still slightly green or just yellow, avoiding the overripe brown ones. Portion size is the next critical factor. A single serving is limited to exactly 1/2 of a medium-sized banana. This limit keeps the carbohydrate load at roughly 15 grams, which is the standard threshold for a safe fruit serving. 15 grams of carbohydrates looks different depending on the fruit's sugar density. It equals 1 small apple, half a banana, 17 grapes, or a single date. This is the core trade-off, sacrificing the volume and sweetness of a ripe banana to keep your glycemic response manageable. Understanding this carbohydrate math allows you to transform a high-sugar snack into a predictable part of your diet. Eating fruit on an empty stomach, or naked fruit, is the fastest way to trigger a sharp glucose spike. This requires a technique called macronutrient buffering, the practice of eating fruit alongside a healthy fat or protein. Adding fats and proteins slows down gastric emptying. This creates a more gradual release of sugar into your bloodstream. Practical examples include pairing apple slices with almond butter or mixing fresh berries into plain Greek yogurt. The trade-off for this stability is the loss of convenience. Buffering requires more preparation and increases the total calories of your snack. That extra effort and caloric density is the necessary cost of safely managing natural sugars. Beyond what you eat, the physical form of the fruit is a major factor. All fruit juices are restricted under this protocol. Juicing removes the natural fiber. Without it to slow down absorption, the concentrated liquid hits your system as an immediate glucose load. Timing is the final layer of defense. The most effective windows for eating fruit are in the morning or immediately following physical activity. Post-exercise, your body's insulin sensitivity is heightened, allowing your muscles to absorb and process the sugar more efficiently. Avoid fruit late at night, as your metabolic processing is at its slowest, which can lead to elevated blood sugar levels throughout the night. Sticking to whole fruit and consuming it during your most active hours provides a secondary layer of protection against spikes. Choosing the right strategy starts with an honest assessment of your current blood sugar control. For those who are newly diagnosed or currently struggling with high daily numbers, a cautious approach is required. In the decision matrix, if blood sugar isn't controlled, you follow the baseline protocol for immediate safety. This limits choices to low GI fruits like berries, citrus, and apples. You can reintroduce dates, but the portion size must remain small, exactly 1 to 2 dates maximum, due to their high sugar concentration. This reintroduction depends entirely on following the rules of pairing and timing we've discussed. Because every individual reacts differently, working with a care team like Arka Anugraha Hospital can help you refine these limits for your specific needs. Approaching fruit through a personalized, strategic protocol gives you the tools to enjoy sweetness while actively managing your metabolic state.